Welcome to Global Products MURX Ophthalmology EHR. This is the main login page. We will log in using the doctor login for a test clinic. Logging in will take us to the main dashboard with a detailed navigation menu on the left hand side, which can be expanded and collapsed, and shortcut panels as can be seen on the screen for quick access to the frequently used sub-modules within the software. We will start with the doctor module or the clinical management page, wherein patient data is recorded. It consists of general ophthalmology section, sub-module, and the subspecialty. Starting with the OPD, the topmost part displays the patient details. Patient medical and social history can be recorded if needed by clicking on Add Update. Options have been provided from which can be selected by selecting from the drop down menu where given, or by clicking on the checkbox which have been provided. Any comments, if any, can be entered in free text format in the text box, and then on clicking on save, it will save the options selected and display in the patient medical and social history panel. Next is recording the ophthalmic examination and the associated findings. The add update button will open the new window with two columns. The left hand column will list the examinations, and the right hand column the associated findings. So it starts with complaints. Clicking on complaints will display the list of complaints. Selections for right eye and left eye can be made by clicking on the check boxes, and comments or advice, if any, can be typed into the details text box. Now these findings can also be searched by using the search option at the top of the table. History, if needs to be recorded, can be done so by clicking on history, which lists all the general history such as skin, medicine history, surgical history, dental, etc. Next is the ophthalmic history. So clicking on ophthalmic history will show the findings for cataract surgery history, glaucoma, lens or spectacles used. Clicking on cataract surgery history, select the option. Next is glaucoma ophthalmic history. Then quick external examination. Clicking on quick examination external is a complete listing of findings, and select the option or search within the listing. And next up are the ocular examinations. We click on ocular examination. It will show the complete list of ocular examinations, just slit lamp, squint examination, scotometry, vision, perimetry. So if we click on squint examination, it consists of ocular movements, cover test, ocular movements, uniocular head posture, vision, for examination for distant vision, color, near vision, and select perimetry, orbit, intraocular pressure, digitally Shiots 10 grams, Visionix with applanation, cornea, examinations, keratoplasty graft, and finally the options which have been selected, click on save and the options will be displayed. So if we select from a distant vision, and for pupil, and save it, it will get displayed. Now examinations can also be added to the database and the associated findings. To add a new examination, we right click on the examination on any of the examinations and add the examination. If there is no parent, you can select no parent examination, or if any sub examinations are to be added to the parent examination, we can select the parent examination and add the examination by typing in the name in examination name and the sequence. Similarly, only if the sequence of the examinations is to be changed, we can just change the sequence by changing the sequence number, and the sequence of the main examinations will get changed. After adding a examination to the database, the findings can also be added by clicking on the findings column, and the sequence number and the finding for the newly added examination can be added to the database in the examination section. Next up is diagnosis. Diagnosis can be recorded using ICD codes from the ICD code database within the software. If any diagnosis is not covered in the ICD codes, that can be typed in by selecting the non-ICD diagnosis option and typing in the diagnosis. We will select the ICD code diagnosis, select cataract. It displays the ICD codes along with the diagnosis. Select the diagnosis type, onset date if any can be recorded. Advice or comments can be typed in the text box and click on save. The diagnosis will be displayed. Current medication, if taken by the patient, can be typed in this free text box format. Now coming to medication prescription, or the medicines or drugs can be prescribed by clicking on add. Medicines can be searched from within the database by using the advanced search, using brand name, generic name, or both, or by the category of the drug. The category can be added or modified in the database by clicking on this button, and the existing category can be modified by selecting and typing in the new category, or a new category can be added by just typing in the name and clicking on add. Medication can be searched by using, say, drops or drop. Select the dosage, 2 drops, frequency twice a day, number of days, and save. Another medication can be added to or prescribed by selecting this. And for ointment, once, while frequency twice a day, days, and save. Once the drugs or the medication has been prescribed, a default prescription button is displayed. The purpose of this default prescription is, for the diagnosis selected, the medications or the diagnosis given, the medication selected can be set as a default prescription for this particular diagnosis. So by clicking on default prescription, the nasal drops and the eye ointment have been made as the default prescription for the particular diagnosis diagnosed. When the next patient comes in and this same diagnosis is selected, the nasal drops, nasalin, and eye ointment neosporin will be displayed. Now, the medications once selected can be edited by the doctor. For that, click on save. Once the save button is clicked, there will be two options to edit the medications or the drugs before the visit is closed, and the diagnosis as well. These edits can be done by the doctor. Now, the medication selected, a prescription can be generated from within the software by clicking on print prescription. The prescription to be printed by the doctor, the format can be decided by clicking on this button. For prescription preferences, whether the prescription is to be printed with the header, with a footer, that is any advice if needs to be printed in the footer part of the prescription with the investigation findings. So any of these prescription preferences can be selected and the prescription can be printed as required with the relevant information. So we select prescription with glasses, diagnosis, and save it. Then next, coming to the glass details, click on the glass details add button or the field and select from the values. For spherical, cylindrical, axis, and visual acuity for right eye, and similarly select from the options and save, and they will be displayed. For distant vision, spectacle details, prism values can be selected from this chart, and again save. Similarly for IPD and NPD. Now there's a listing of glass type for the prescription, the type of glasses to be given to the patient. Again, the glass type can be changed or added or modified by clicking on this button. The option to be modified needs to be selected. The modified label needs to be typed in and click on modified, or if any new label is to be added, just click on add by typing in the new glass type. Similarly, for glass material, there's a listing. Again, this can be modified or any new glass type can be added. Glass use type, special instructions for if any. All these can be modified by clicking on this button and added or modified as required. And the glass coating. Next, coming to the clinical vision, select from the values, save it, they will be displayed. Auto refractometer readings, click on the add button and select from the chart. And save, and it will be displayed. Advice, if any, can be typed in. And save to the database. A reminder can be set by the doctor for this patient for his follow-up visit. There's a listing for reminders regarding the payment or any tests to be done. So when the patient comes in for a checkup in a follow-up visit, and the doctor opens up the clinical page, the reminder message is displayed. Now these reminder messages can be added or modified as a requirement. And then we click on save to save the OPD data. Prescription is printed by clicking on print prescription. With the prescription preferences selected, it will be saved to the desktop or the laptop, and clicking on this button shows a test prescription. With the options selected, it is printed. Next is, after the OPD are the images. MURX has a built-in image editor which can be used to edit and save images. Click on the image and the image will open in the image editor. It can be marked up or text added. Click on save, and the image will be saved. You can select from the option whether the images for right eye or the left eye, and description if any can be added. Images from previous visit and the current visit, the two images can be compared by selecting the main image and the image to be compared in the software. Allergies, if any, can be recorded in the allergies tab. Contact lens details can be recorded by clicking on the contact lens tab. The details can be selected by according to the model. There's a listing of the lens models from which the desired one can be selected. Again, the model listing can be added to or modified as required. Then next are the type of lens: semi-soft, soft, toric soft, disposable. The type 2 can be added to or modified, and the company name can be selected from the given list, such as Alcon, Orolab, Ocular Vision Care, Hoya, Zeiss. The company names can be added to the list or modified as required. The tint remarks, if any, can be typed into the text box, and values for the lens can be entered. The spherical, cylindrical, and axis values selected first get populated, and the respective values can be typed in and added to the list, which will display with the date, the right eye, left eye values entered, and the ones selected from the list. Next is the intraocular tab. Intraocular lens values or details can be recorded in this tab. The design list from which the design can be selected. This list too can be added to or modified. And according the company name can be selected, which two can be added to or modified, and the values entered for K1, K2, Acon power, overall length, and optic size, and added to the list and saved. Next, coming to the billing and payments part. Bill can be generated from within MURX, and payment collection can be made based on cash, check, credit card, or other UPI based methods depending on the clinic. The billing head can be selected and displays the amount. The billing head and the amount can be specified as required or modified by specifying the billing head code, billing head name, and the amount for the same. Consultation example charges are added. Next is for IPD bed charges, can add the total amount. Discount, if any, can be specified, and payment can be collected by clicking on new payment. If the payment is being collected in cash, select the cash option and record the date, the amount paid, and remarks, if any. If the amount is collected by check, click on the check option, and the check details can be captured and saved, such as the check date, check number, amount paid, bank name, and a remark, if any. Credit card or debit card details, if payment is being collected by that mode, again can be recorded, and other options such as Bhim UPI, PhonePe, Google Pay, or Paytm if the collection or the payment is to be collected by that method. So this is the billing and payment section in MURX. And coming to the surgery part, clicking on the surgery button next to history of patient visit will take us to the surgery submodule, starting with the new surgery tab. The surgery name can be selected from the list. and pre-surgery instructions, if any, which can be added to or modified in the list, and they can be selected and saved, and they will display pre-surgery instruction. Similarly for post-surgery instructions, can be saved and they are displayed. Doctor's note, if any, can be typed in free text format. The surgery on which eye, surgery date, and the timing can be recorded. Print options are provided, pre-op instruction or post-op instructions, and discharge and save. Next is surgery completed details, surgery name, surgery date, surgery time, pre-instructions. Pre-surgery instructions can be typed in. Similarly, post-instruction and doctor's note. Then the next tab is the discharge summary, which includes operation, the diagnosis selected, details if any, admission date, operation date, eye sketch, which can be marked up, the name of the surgeon, associated surgeon, the anesthesia, and anesthetist. His names are added to the list. Prescription, previous prescription, or the medications which were given in OPD are displayed over here. Similarly, any other medications that need to be given can be selected from the database and added to the list, and a prescription printed out. Also, IO lens details have been added to the surgery module, which will record the date from the list, design, and the company name, and the details of values for the IO lens, and they will be added to the list. This is the surgery module. And again, coming to the clinical management subspecialty module. Come to the subspecialty module, which is consists of cornea follow-up, injury, retina, keratoplasty, glaucoma, and pediatric subspecialty modules. Here, the required information where required can be entered in free text format. These images can be marked up using the built-in image editor. Text, if any, can be added. This image can be saved. Similarly, intraocular pressure, operative details will date, keratometry, manual auto-K, topography, specular microscopy, and all these details, corneal scrap, can be entered in free text format and saved. Then next subspecialty is injury, history of presenting illness, details of the classification according to mechanical, closed globe injury, lamellar laceration, open globe injury details, the ocular trauma score for vision, globe rupture, perforating injury, the Roper Hall classification. Then coming to the retina subspecialty, color vision, complete anterior segment, retina exam and fundus exam, investigation, OCT interpretation, injection number, date given by OCT MAC thickness and the date, and keratoplasty subspecialty, again history of presenting illness, ocular examination. This image can be edited, OCT macula, corneal pachymetry, axial length, retinoscopy, IOP using Shear's eye care, applanation digital, operative details, surgeon donor details, cornea status, post operative details, histopathology, organism, follow up. All these details can be entered and saved for keratoplasty. Then coming to the glaucoma subspecialty, medications along with the date, anterior segment image, intraocular pressure using Shear's eye care applanation, central corneal thickness, fundus examination, undefined details, perimetry, and finally the pediatric subspecialty, complaints, duration, complaints such as white reflex, birth history, vision, IOP, color vision, facial symmetry, squint motor assessment. All these details can be entered and saved. Once all the details have been saved and recorded, you need to close consultation so that the current visit is closed. Then next, reports are also generated in MURX, such as patient diagnosis list, the list of patients based on a specific diagnosis are generated from within the software. We select for senile cataract, select the date range, and search will give a list of all the patients with the senile cataract diagnosis, and a printout can be given. Similarly, patient medication list report is also generated in MURX. Any new drugs that need to be added can be done so from within the master's list by the doctor. In the drug master, drugs can be added to the database by selecting add new, a drug code, the drug name, brand name, company name, and the drug category. So the drugs can also be, or medications or medicines can be added to the medicine database. So this is the Global Products MURX Ophthalmology Electronic Health Records software. Thank you.